hormone produced by the beta cells of the pancreas. Its primary job is to regulate the metabolism of carbohydrates, fats, and protein by facilitating the absorption of glucose, sugar, from the blood into the body cells, where it is used for energy. Think of it as a key that unlocks the doors of your cells to allow glucose to enter. How does insulin work? The process is a finely tuned feedback loop. 1. You eat. When you consume food, especially carbohydrates, your body breaks it down into glucose. 2. Blood sugar rises. Glucose enters your bloodstream, causing your blood sugar levels to rise. 3. Pancreas responds. The pancreas detects this increase and releases insulin into the bloodstream. 4. Cells unlock. Insulin binds to receptors on cells, like muscle, fat, and liver cells, signaling them to open up and absorb the glucose. 5. Blood sugar normalizes. As glucose moves into the cells, the blood sugar level drops back to a normal range. 6. Storage. Any excess glucose is converted into glycogen for storage in the liver and muscles for later use. Insulin and diabetes. Diabetes is a chronic condition characterized by problems with insulin, leading to high blood sugar, hyperglycemia. There are two main types. Type 1 diabetes. The body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. The pancreas produces little to no insulin. People with type 1 diabetes require lifelong insulin therapy to survive. It is an autoimmune disease, not caused by lifestyle. Type 2 diabetes. The body becomes resistant to the effects of insulin, meaning the cells don't respond properly to the key. Initially, the pancreas produces extra insulin to compensate, but over time it can't keep up, leading to insulin deficiency. Management can involve lifestyle changes, oral medications, and often, insulin therapy as the condition progresses. Gestational diabetes occurs during pregnancy when hormones cause insulin resistance and the pancreas can't produce enough to overcome it. Types of medical insulin. For people who need insulin therapy, different types have been developed to mimic the body's natural insulin release. They are categorized by how quickly they start working, onset, when they peak, and how long they last, duration. Type onset, starts working, peak duration, how long it lasts, role. Rapid acting, e.g. Lispro, Aspart, Glulisine, 15 minutes 1 to 2 hours, 3 to 5 hours taken just before a meal to cover the carbs in that meal. Short acting, regular, 30 minutes 2 to 3 hours, 6 to 8 hours taken 30 minutes before a meal to cover meals. Intermediate acting, NPH, 2 to 4 hours, 4 to 12 hours, 12 to 18 hours provides a base level of insulin, often taken twice a day. Long-acting, e.g. Glargine, Detamir, Degludec, 1 to 2 hours has no pronounced peak. 18-24 plus hours provides a steady, background, basal, insulin level throughout the day and night. Premixed, e.g. 70/30ths, varies a fixed combination of intermediate and short-acting insulin. How is insulin administered? Insulin is a protein that would be destroyed if taken as a pill, digested in the stomach. Therefore, it must be injected or delivered via other non-oral methods. Syringes. Draw insulin from a vial. Insulin pens. Pre-filled or cartridge-based pens with a dial-a-dose mechanism. Very popular and convenient. Insulin pumps. Small electronic devices worn on the body that deliver a continuous trickle of rapid-acting insulin, basal rate, and allow for bolus doses at mealtimes. Inhalable insulin. A rapid-acting insulin that is inhaled at the beginning of a meal, less common. Artificial pancreas systems, APS, also known as automated insulin delivery systems. These combine a continuous glucose monitor, CGM, and an insulin pump, using an algorithm to automatically adjust insulin delivery based on real-time blood sugar levels. Important considerations. Hypoglycemia, low blood sugar, the most common side effect of insulin therapy. It can occur if too much insulin is taken, not enough food is eaten, or from excessive exercise. Symptoms include shaking, sweating, dizziness, and confusion. It must be treated immediately with fast-acting sugar. Storage. Unopened insulin must be refrigerated. Once opened, most insulin can be kept at room temperature for about 28 to 42 days. Check the package insert. Dosing. Insulin dosing is highly individualized and is managed in close consultation with a healthcare provider. It's based on factors like blood sugar levels, carbohydrate intake, and physical activity. In summary, insulin is a life-saving hormone essential for converting food into energy. For millions of people with diabetes, administering insulin is not a choice, but a necessary medical treatment to maintain health and prevent dangerous complications.